Aloha, this is Dr. Colgin from Optimal Health Members in Henderson, Nevada, near Las Vegas. So let's talk today about how structure alignment equals better function. And what I mean by structure alignment, I mean by structure alignment of your spine here, okay? When our spine is more in line, we're gonna have better function to go with it. So let's go over that for a second. And when you think about not just the spine, but think about anything in life. If you don't have proper structure with it, you're not going to have the optimal function. That could be in the workplace. That could be with your relationships. It could be in your marriage. Sorry, my wife's not here right now. That's okay. She's great, just so you know. It could also be with finances, operations, you name it, right? You get the idea. Or anything, any kind of technology for that matter, your computer, your systems at home, whatever it is, right? So structure matters, but function matters even more. So let me get this right, or give you some case in point here. So with the spine, we have the neck, we have the mid-back, we have the lower back. You got nerves that come out of the spine. These nerves don't just go to your muscles and to your skin. They go to every organ, cell, and system of your body. Think about that for a second. So the best way I could explain the spine to you is to think of it as your circuit box, okay, or your breaker box, all right? What happens if there's a power surge? Well, it's gonna flip a breaker, right? So one of your lights switches aren't working, or maybe the power went off in the house. You open up the circuit box or the breaker box, and you see which breakers have been tripped, right? Well, the obvious choice is, well, let's just flip them again to make sure they work again. Well, that's kind of what we do in chiropractic. We have areas of the spine that go out of alignment, which is equivalent to a breaker in your breaker box that needs to be reset. So we're just kind of, when we realign you, we're like resetting you. So we're resetting your power grid is what we're doing. So something here, like in the lower part of your neck, these are the nerves that go out, they go down your arm into your hands. Let's say if you're out of alignment here and you're wondering, why am I having this tingling or lacking sensation going down my arm? Well, let's go to the root cause of that, right? We're not going to obviously take a pill that's going to help that, because this is a physical problem. This isn't a chemical problem. And for every physical problem you have, there is a physical solution. So chiropractically, this is something I've been living by for the past, since I was 15, which was only 2 years ago. No, actually, since 1986 when I first met my chiropractor. So I've been taking this, been using this advice on me and also with the thousands of patients that we've helped over the years to think about this. Rather than take a pill for something, let's look to the root cause of a problem here, reset that, and put things back into motion the way they should be. So again, we get proper structural alignment, we're going to have proper function. Another great way to understand this too is your car, right? If your tires aren't in alignment, what's going to happen to your tires? Well, I can tell you what's going to happen to the steering. The car's going to kind of veer to the right or to the left. And then after that, what's going to happen? The tires are going to start wearing down. Well, do you just replace the tire, or do you take care of the alignment of the steering, right? I think the choice is obviously take care of the steering alignment. That way, you don't wear down many tires. Same thing with the spine. The more you keep this in line, the healthier you'll stay and become, less money you'll have to pay on other things later. And when you invest in your health today, that prevents you from going bankrupt tomorrow. Because we all know that there's times where people in our life come and go. There's a sudden heart attack, which is the silent killer. It could be cancer, it could be diabetes, it could be many different things that people are going through right now. But if they took the time to understand structurally what's going on with them, they would also have a better idea functionally what needs, how they are functioning and to what degree and to a performance standpoint. So there's the old saying, hey, you better check yourself so you don't wreck yourself, right? That's what we do as chiropractors. We help our patients on a regular time to make sure that they're always fine-tuned, ready to go, and we do a performance check, right? And that can be done in many different ways. The first way we do is by starting off with a very comprehensive evaluation, where we do a couple of diagnostic tests, find out where there's any kind of, let's say, nerve interference, any kind of disruption in normal pattern activity with their muscle firing or muscle function. see if there's any hot spots that we use or any signs of inflammation in their spine. We use thermal vision by MyoVision, which is a thermography diagnostic tool. And also, too, we do a body composition analysis. So when they stand on the scale, it gives us an idea of how much they weigh, but also it breaks down all that weight. What is their BMI? What is their body fat percentage? What is their visceral fat? How hydrated are? How much muscle mass they have? We give them a lot of data to show them that, hey, these might be some of the things that are causing some of your problems, that are interfering with your structural alignment, that can create the function that we don't want, but at least we know what we're looking at, okay? It's like running a diagnostic on you. Let's run a diagnostic, put a plan into place, retest, and make sure the car is always running at optimal. And remember, the harder you run the car, the more maintenance you're gonna need. So put that in perspective too. Anyways, but that's my whole thing. So as chiropractors, we don't just see people for neck and back pain. We see people to help keep them healthy. They don't have to be in pain to see us. The first chiropractic patient back in the late 1800s, 1896, was actually a deaf person. And when he got his first adjustment, or second adjustment, after being deaf for 15 years, he could finally hear. So as a profession, we're found on tone, and that's tone of the nervous system. Okay, the nervous system is basically your brain and the spinal cord. Pretty cool, huh? Anyways, I hope you found this topic of interest. Thank you for, again, being here with us on Optimal Health Members Live. And remember, the body always wants to heal. Aloha for now.